Hello, and welcome to our 5-minute medication review. Today, we're going to be talking about calcium chloride. Calcium chloride does not have a trade name, and it's classified as an electrolyte. We carry it in our drug boxes as 1 gram and 10 mLs. The way that calcium chloride works in the body is that it increases extracellular and intracellular calcium levels. It also stimulates the release of catecholamines, meaning dopamine, epi, and norepi. So we could expect some increased contractility of the heart when giving this medication, otherwise known as positive inotropic effects. It is essential to a number of physiological processes, including the transmission of nerve impulses, contraction of both cardiac, smooth, and skeletal muscles. So, calcium does play a huge role in contraction of all of your muscle cells. And it has its stabilizing effect on the myocardial working cell membranes in the setting of hyperkalemia or excessive potassium. Okay, so when would we use this medication? Is suspected hyperkalemia, and then it is an antidote for calcium channel blocker overdoses. Okay. Some absolute contraindications for calcium chloride include we would not use this for digoxin toxicity or hypercalcemia, so somebody that already has too much calcium. We wouldn't use this on suspected severe hypokalemia, okay, because life-threatening cardiac arrhythmias can occur if we do give this for somebody who has low potassium. And then calcium chloride allergies. So, some precautions and side effects with calcium chloride. It may cause discomfort in the injection site, and it will precipitate if we mix this with sodium bicarbonate. So, we don't ever want to mix sodium bicarb and calcium chloride in the same line, because what can happen if we don't flush these properly in between, or if we're giving them back to back, or even mixing them, we would want to do this because these drugs can precipitate, basically forming crystals, and we don't want that to happen. So we can give this medication IV or IO. And the four guidelines that contain calcium chloride are these: hyperglycemia, cardiac arrest, extremity trauma, and dermal chemical burns. All of these offlines can contain patients that could potentially be hyperkalemic. So remember, when we have a patient that is suspected to be in a hyperkalemic state, some things that we're looking out for is, on the monitor is peak T waves and eventually widening of the QRS. Okay. So the reason why we would give calcium chloride in these is essentially because of its effect on stabilizing the myocardial cell membranes. Okay. And the way we would give this for hyperglycemia, if we're suspecting hyperkalemia, is 1 gram over 5 minutes, IVIO. We would give for cardiac arrest 20 milligrams per kilogram. The max dose is 1 gram over 5 minutes. For extremity trauma, it's 1 gram over 5 minutes IVIO. And then for dermal chemical burns, it's the same 1 gram in 5 minutes IVIO. Not to exceed, again, with all of these drugs, we're not going to exceed 1 ml per minute to this patient. So I hope you learned something a little bit about calcium chloride today. Thank you for listening.